All right, committee members, and just in time, we're going to our last posted item of the day. We have 1 hour left and multiple speakers on both sides of this issue. We'll get a brief presentation from staff. And this, depending on how much time is left, we will lose a quorum here at 4 p.m. today. So we want to hear from speakers, but at the same time, leave some time for discussion and possible action. So we may limit the speaking to an equal amount on each side of the issue. But we'll start with the staff presentation. Welcome, Dr. Wong. Welcome, Carlos.
Thank you. Good afternoon, Carlos Rivera, Director of Health and Human Services. Dr. Huang and I are going to be presenting the department, some information regarding fluoride use throughout the nation and some standards that have been set nationally by EPA and also by CDC. And we're also going to make some recommendations. Dr. Huang has a lot of experience dealing with this issue on a local level, so I'm going to turn over the mic to him right now and have him talk a little bit about the science behind the matter.
Okay. Well, we first wanted to start just reviewing some of the EPA review of the current science on fluoride. And again, what EPA, identified is that the primary drinking water standard, or the maximum contaminant level, is 4 milligrams per liter. And what's that is...
Dr. Wong, I'm
yes.
sorry, I don't think your microphone is on.
I think, well, okay. Okay. That better?
Much better. Thank you.
All right. And so they identified, again, that the highest level that's allowed in drinking water, or the maximum contaminant level, is 4 milligrams per liter. That's an enforceable standard, and it was set to protect the public from actual health risks over a person's lifetimes, and they identified that for skeletal fluorosis, and that's what the calculation was made based on. And then they identified a secondary standard of being 2 milligrams per liter, and that's not an enforceable standard, but it's a guideline to regulate contaminants that may cause either cosmetic, such as dental fluorosis, or aesthetic effects, such as odor, taste, or color problems. Now, the U.S. EPA, the drinking water standards, they review it every 6 years to determine the need for revising the standards, and that's a good thing. Again, so, there was some new standards and recommendations that came out recently, and so they are periodically looking at the new peer-reviewed data on fluoride. And the National Academy of Sciences had recommended that the U.S. EPA conduct a dose-response analysis of the data and also an assessment of the exposure to fluoride. So what they did with the dose-response analysis, the objective was to identify a concentration that protects for sensitive exposed populations, children, that are vulnerable to severe dental fluorosis, and identify a concentration that would also protect against more serious adverse effects, such as skeletal fluorosis or skeletal fractures. And this response analysis they used, it used data from the 2006 National Research Council report and included data from studies identified between 2000 to 2010. And the objective of the exposure assessment to determine sources of fluoride for the U.S. population, to quantify exposures for age groups of concern, to compare oral intake with the oral reference dose used to calculate the MCL, and estimate relative source contribution, and provide information to reduce the population risk and adjust the MCL if it was necessary. And so the relative source contribution, again, is to develop better estimates of total exposure for individuals. The U.S. EPA assessments, they considered the concentration of fluoride in foods and beverages, dietary exposure estimates, concentrations in tap water delivered by public water supply, estimated fluoride intakes from toothpaste, and estimated exposure to sulfuryl fluoride, which is a pesticide. And so...
Now, I just want to, before we proceed, thank the staff and Dr. Huang. A significant amount of time has gone into preparing these materials for our review today. And there's no lack of literature in this area. In fact, the literature is quite clear. As Dr. Huang has stated, the EPA has a primary drinking water standard, and it's 4 milligrams per liter, and the secondary standard, 2 milligrams per liter. The CDC states that optimal fluoride level is 0.7 milligrams, and the City of Austin fluoride level is 0.7. Fluoride promotes the public health benefits, or the current recommendations promote the public health benefits of fluoride for preventing tooth decay, while minimizing the adverse effects of diseases such as dental and skeletal fluorosis. Now, here's the thing. I mean, again, as I said, there's a lot of literature available in this area. Can you change this slide for me? And here are a number of supporters of fluoride. It's a who's who of science in the United States, and it's also a who's who of science. The World Health Organization is also another organization that supports the use of fluoride. It's important to note that, you know, during our reviews, we did do a significant review, and again, very great thanks to Janet Pichette, our toxicologist, and her staff, and we only found one organization that went from supporting fluoride to having a neutral position, which was the American Kidney Foundation, the National Kidney Foundation. So they went from supportive to neutral. But as you can see, there are many. Oh yeah, and we also have for here available to you a notebook of a lot of literature that we use to, you know, to reach our conclusion. So breastfeeding is ideal for infants. You know, when we put the fluoride, when you're using water with fluoride in it, we prefer that moms breastfeed their infants. But if you can't breastfeed your infant, you can use fluoridated water for preparing infant formula. And recent evidence suggests that mixing powdered or liquid infant formula concentrate with fluoridated water on a regular basis may increase the chance of a child developing the faint white markings of very mild or mild enamel fluorosis. So, you know, the science shows that that's the extent of the risk from fluorosis. We have information posted on our website regarding a protocol that CDC put out for the use of how to mix infant formula with fluoridated water, or at least some instructions on what steps that should be taken and things that should be considered. It's not only on the Health and Human Services Department website, but it's also on the utilities website too. The information on the website addresses fluoridated water at a level optimal for oral health, and once again, it poses no known health risk for infants. Breastfeeding is the best source of nutrition for infants. If breastfeeding is not possible, you can minimize exposure to fluoride by using ready-to-feed formula. So there are alternatives for parents that do have concerns. You can also alternate using tap water and non-fluoridated water for formula preparation, or mixed powdered or liquid infant formula concentrate with low fluoride water most or all of the time. And again, all of the information that we have posted on our websites is provided by the CDC. So our recommendations. We concur with the CDC's recommendation that the use of fluoride in drinking water is indicated for public health. It's a promoter of health in our population, and the literature clearly supports it. We're more than happy, from an informational standpoint, to post information at the city's website and at neighborhood centers and at WIC stations within the department to, continue our efforts to be transparent with the public and also provide them with additional information that can help them make an informed decision regarding the use of the fluoridated water. And through our sister departments in the city, we would recommend that they produce an annual insert to be mailed in an Austin Energy bill highlighting information from the city's website. I'll close by saying that there has been one additional thing that has occurred nationally, and that's the Santa Clara Valley Water District and folks in California in the San Jose city area making a decision at great cost, between $4 to $9 million, which, with a cost of $800,000 a year, to fluoridate their water. Now, this was the last remaining, or the largest remaining populated area in the United States that was not using fluoridated water, but they indeed have taken on the responsibility of, making a significant investment in the well-being of their population and have indeed fluoridated their water. Thank you.
Carlos, thank you, Carlos and Dr. Wong. on our utility website and on the Health and Human Service website, I assume it's both in English and Spanish?
Is it in English and Spanish? It's in English, but we can correct that. We'll correct that immediately.
Please do. And so if you were to do an annual insert into billing information, what exactly would you provide as information in that insert?
Well, I mean, again, the CDC warning, there are other water suppliers throughout the nation that already provide the information. It's very similar and consistent with the CDC's information statement. And it would read as follows. This is what we have currently. And again, we wouldn't really deviate much from it. Water that is fluoridated at a level optimal for oral health poses no known health risks for infants. However, some children may develop enamel fluorosis, a cosmetic condition where faint white markings or streaks may appear on the teeth. Fluorosis can affect both baby teeth and permanent teeth, whether forming under the gums. If you're concerned about fluorosis, you can minimize your baby's exposure to fluoride in several ways. Breastfeeding is the best source of nutrition for infants. If breastfeeding is not possible, you can minimize exposure to fluoride by using ready-to-feed formula. You can also alternate using tap water and non-fluoridated water for formula preparation or mix powdered or liquid infant formula concentrate with low fluoride water most or all of the time. However, if you use only non-fluoridated water such as purified, demineralized, deionized, or distilled bottled water to prepare your baby's formula, your baby's doctor may recommend fluoride supplements beginning at 6 months.
So that would be what you would recommend as a warning or information on an insert?
This is what's currently on our website.
Okay.
And it would be consistent with that statement again, which is consistent with the CDC's position.
But could we also, if obviously we haven't decided anything, but if we were to do this, I believe at the last meeting, Dr. Wong, you mentioned a report that is an annual requirement that is listed somewhere on our website about every known element within our drinking supply, our water.
Austin Water does provide that information annually.
And so could we provide that link as well in this so that not just fluoride, but everything that we possibly find in our drinking water?
Yes, we could provide that link.
Okay. Thank you. Please, if you have... I think you were here at the last meeting, and you were the one that mentioned it, didn't you? I apologize. I don't remember your name.
That's okay. I'm Jane Brazier with the Austin Water Utility. I'm the Assistant Director of the Treatment Program. We are required by the EPA to mail out a Consumer Confidence Report annually, which has everything in the water, what's not in the water. On the electronic version of that on our website is where we do have all the information on fluoride. And so there'd be no problem including that information or links.
Who are we required to mail that out to annually?
Right now, it's done as a bill insert. Information we're getting right now is that with the new billing system, because of paperless billing, we will have to do a direct mail out. With the direct mail out, we won't be as limited to size, so we could include more of this into the Consumer Confidence Report if we have to mail out a hard mail out with paper copies.
And I'm reading your letter that you provided to us, Jane.
Well, the information on not being able to do it as a bill insert has just come out within the last day or two. So we'll probably get more information back from TCEQ and EPA, but we are assuming right now we may have to do a hard mail out.
Okay. Thank you. All right, committee members, thank you guys for the presentation. We do have, as I said, more than enough speakers to keep us here for a while. What I'm going to do is start out by limiting 5 speakers per side. I'm just going to go in the order that you signed up and that was handed to me. That'll leave us about 15 minutes for this committee to discuss and or take any potential action. And there was a request made that the anti-fluoridation speakers be allowed to speak first. So I will call Laura Presley up first. Welcome, Laura. You'll have 3 minutes.
So I'd like to reorder that if that would be okay, because it would be different.
Sure.
if you want 5 people.
I mean, I was going to try to do 30 minutes. We just don't have time. We're going to run out of time. And
I hear you, but so because of that, I need to
just whoever,
change it.
whatever 5 folks you want to come
Can
up.
I see my list again?
Absolutely. There you go. Laura, there's 4 on this page. I don't know if you... I'll just read them. I'll make sure I read everyone's name into the record. Welcome, Laura. You have 3 minutes.
All right, Council, if I were in your spot, how would I make the decision on fluoridation and putting this warning on the bill? I'm in Whole Foods very frequently, and I've seen each one of you in there shopping. So I know that you care about, Council, maybe it's an event or something. You were there. But I know you guys care about what goes in your bodies. And if you want Austin to be healthy, healthy water is the primary thing that makes us healthy. And you drink more water and drink more fluids than you eat food. So water is number 1. Also, I would look at the agencies promoting fluoridation. The American Dental Association has said it's a topical mechanism that it works and not by swallowing. The primary mechanism is topically. So why are we drinking it? Okay? Also, the CDC. They did change the maximum or the recommended level. For 60 years, it was at 1.2 part per million. They changed it. And we have 40% fluorosis in our teenagers. And in 10 or 20 years, are they going to change it again? So that's the question. Are we guinea pigs? And the data that we have now, statistically scientifically supported research shows there's issues with hypothyroidism, bone cancer, and IQ degradation in children. And in 20, 30 years from now, are we going to say, man, I wish we'd listened, that that's the truth? And as a council member, can you personally guarantee that 0.7 ppm does not negatively affect anybody in our population? I'm going to give you 2 examples where I think that is an issue. Athletes in the summer will drink probably 2 gallons of water while they're getting ready for football season. That's 8 liters. They will have 5.6 milligrams of fluoride in their system on a daily basis. That's a big number. That's above this 4 ppm limit. Infants can drink their weight in water in 3 days. If an adult had to drink their weight in water, you'd be drinking 72 liters of water in 3 days, 22 liters a day, 14 milligrams of water, of fluoride.
I would drown if I had to drink.
I know. But the thing about it is infants are getting a higher concentration than we are. We wouldn't drink the 22 liters, okay? Also, the CDC says we're doing this for the economically challenged populations. When LULAC and the Martin Luther King family has said, thanks, but no thanks, you can keep your fluoride, our people are being adversely affected more than Caucasians. We want a warning on the bill that goes to everybody because there's a one-size-fits-all dose, and that does not work for all of us. And as these dentists and other fluoride supporters speak out, I ask you to ask these questions. How should they handle dose control? How do they even argue that that's reasonable? There is no dosage control for those sensitive populations.
Thank you, Dr. Preston.
Thank you.
The next speaker is Mike Ford. Welcome, Mr. Ford. You have 3 minutes.
Thank you.
After Mr. Ford is Ray Nadler-Olnick.
There are over a dozen studies that correlate fluoride and loss of IQ. Think of that. There are over a dozen studies that show that. And what I'm shocked about is the city of Austin wants to have a program of putting fluoride into the water, knowing it lowers the IQ of children. I mean, this is mind-boggling that the city of Austin would have a program that lowers the IQ of its children. What is going on? Help us. Don't lower the IQ of our children, please.
Next speaker is Ray Nadler-Olnett. Welcome back, Ray. You have 3 minutes. After Ray is Griffin Cole.
Afternoon, committee. The idea of warning the public through the website would make sense if the website warning were honest and meaningful, but it's not. Quite the reverse. The words have been crafted in an extremely misleading way. And Mr. Rivera just read what the city of Austin has to say about it, and it's also on your handout up there. Now, in 2006, the American Dental Association and the CDC, basically, in response to skyrocketing dental fluorosis, issued some feeding guidelines for babies up to 12 months. Your handout has that too. And will you please project the second of those two? Okay. The fluoride in infants material that was added to Austin Water Utilities website last summer, and I gather to Public Health and Human Services also. I didn't see that. Anyway, it should reflect the ADA and the CDC's intent. Unfortunately, it doesn't. So let's compare the relevant portions. ADA says, quote, if liquid, concentrate, or powdered formula is the primary source of nutrition, it can be mixed with water that is fluoride-free or contains low levels of fluoride to reduce the risk of fluorosis. These include water labeled as purified, demineralized, deionized, or distilled, as well as reverse osmosis filtered water. Many stores sell these types of drinking water for less than $1 per gallon, unquote. Okay. Now, the city of Austin's version, quote, you can also alternate using tap water and non-fluoridated water for formula preparation or mixed powdered or liquid infant formula concentrate with low fluoride water most or all of the time. However, if you use only non-fluoridated water, such as purified, demineralized, deionized, or distilled bottled water to prepare your baby's formula, your baby's doctor may recommend fluoride supplements beginning at age 6 months. Well, he might, but it would be outrageous. That last sentence is fanciful, to say the least. Nowhere does the ADA directive state or imply any such thing. Back when it first appeared, I challenged the Austin and Travis County Department of Health and Human Services to substantiate it and received no response. So now's a good time to bring it up. The last sentence needs to be struck. Then the whole thing should be rewritten consonant with ADA's directive, as it is in these 18 or so other venues nationwide that followed the ADA's lead in issuing warnings of their own. After that, maybe we could talk about pointing to the website. And are there any questions? Thank you.
Any questions? Thank you, Ray. Dr. Cole? Welcome back, Dr. Cole. You have 3 minutes.
Thank you, guys. Okay, so I'm glad they've been talking about the CDC because I wanted to give a little insight into this statement that I've been hearing for 18 years now, or at least a statement close to this one, which is that the CDC considers water fluoridation one of the top 10 public health achievements of the 20th century. So if you go into the Freedom of Information Act, you'll actually find that there was no toxicologists involved in this statement, no health professionals except for one dentist, no diabetes experts or anyone outside the oral health division, which, by the way, is only 30 members of a 14,000-member agency, had no input into this. If you go to the next slide, please. And actually, where this first was published was in Morbidity and Mortality Weekly Report, which is an in-house journal. It's not peer-reviewed. This was basically two people, Scott Tomar, a dentist who has never published on fluoridation before this, and Susan Griffith, an economist. This is where this statement that we hear over and over again came from. two people in an in-house magazine. They're not toxicologists. And again, there's 14,000 members in the CDC. So I think we put a little too much weight into that statement, which, by the way, is based on the 1993 NRC report, which has been overruled by the 2006 one. Next slide, please. This is the World Health Organization's own study here. And if you look very carefully, this shows a lot of countries. Some fluoridated, the bottom 5, all the rest unfluoridated. Notice the trend in actual decay rates. It's gone down everywhere. It has nothing to do with actually drinking fluoride. This is a pretty clear, and some are even more dramatic than others that are in non-fluoridated areas. Good. Okay, this is a 1979 ADA statement. Individual dentists must be convinced that they not be familiar with scientific reports and field investigations on fluoridation to be effective participants, and that non-participation is overt neglect of personal responsibility. This is what they said back in 1979. Well, I'm a dentist who likes to look into literature, and I haven't found a study like he was talking about that has proven in a double-blind, valid study that drinking fluoride is beneficial to the teeth. There's been plenty to show that topical is, but not drinking it. Next slide, please. So I find that there's 3 inherent flaws with this. One is that, again, if you swallow it, it's not doing its intended function. So that should nix it right there. Number 2, it's not fluoride. It's hexafluosilicic acid, which is a waste product from the fertilizer industry. And the most important thing is, again, as I mentioned numerous times, there's no dose control. So an infant is going to drink their weight very quickly as compared to a large adult. So there's no way to actually control the dose of what people intake. Next one. So one final quote that I need to read is very important. Sometimes groups in authority actually get it right. And just to show that I'm not anti-dentistry, because I am a dentist now for 18 years, this is a statement that was made by our authority. We do know that the use of drinking water containing as little as 1.2 to 3.0 parts per million of fluorine will cause such developmental disturbances in bones as osteosclerosis, spondylosis, and osteopetrosis, as well as goiter, and we cannot afford to run the risk of producing such serious systemic disturbances and applying what is at present development of dental disfigurements among children. Guess who said that?
Dr. Cole, thank you. Your time has expired.
Last slide, please.
Dr. Cole.
That's who said it.
Your time has expired. The next speaker is Carol Vanderstook. Welcome back, Carol.
Thank you.
You'll have 3 minutes.
I appreciate that you've had us here again. You all know me as the author of an oral systemic book that's been well received. What you may not know is that 5 years ago, I would have sat on the other side of the aisle. I was a pro-fluoridation person for sure. Only in looking at systemic issues did I begin to really look at what fluoride did. I would hope that those people who, and I look forward to hearing what they say because, but I'd also want them to, I would want to know that they had read this NRC report about all these issues that have been brought up that are systemic issues. I would want to know that they went beyond the trade magazines that we got that simply said that in January when we lowered the maximum contaminant dose in drinking water, that it was due to all the other dental uses, but they disingenuously left out the fact that in the last several decades, fluoride-based pesticides have infiltrated our food supply. It's found in tea in 887 parts per million, flour 125 parts per million, coffee can be 20 parts per million, and of course bottlers, and it's found in all sorts of things. So I'd want them to know that those are some of the sources. Now, of course, it's already been pointed out that systemically fluoride doesn't work. Fluoride advocates know that it works through remineralization of teeth. But it can only do that. I hope they've read the studies that show that in order to do that, the teeth have to be plaque-free. The target audiences that we're talking about very often come in with a picture in the upper left-hand side with plaque right at the gum line and in between. People are very poor at getting that off their teeth, and 30 minutes of sustained exposure is not likely to happen for these people. When I started writing the second edition for my book, I ran into some of the top dentists in the world that had me look at dentistry completely different ways. At that time, it shocked me to know that perhaps as little as 8% of dentistry is actually based on peer-reviewed, published, and appropriately analyzed dental research. But as I started learning more about minimally invasive dentistry, I realized that using our old ways of doing things, which is simply using a probe and x-rays, we're way behind catching decay early, and that's still how most dentists do it, but that's only about 25% effective. So my question is, these studies showing that decay rates decreasing, I think that perhaps what we're looking at is that we're simply delaying diagnosis of what's really going on. A lot of dentists don't know, and I certainly didn't know until the last year, that once a tooth is demineralized, that when the tooth remineralizes, whether through fluoride or any other agent, it forms an amorphous surface through which acids can still seep through to cause decay below. But if the surface remains intact, it's going to be a long time before we can detect that in x-rays. It has to be 2 to 3 millimeters into the second layer of tooth before we detect that. So here's another picture that kind of shows that. You can see that the surface is intact, and yet the decay is happening in that second layer. The dentist could probably easily pick out that this is the second upper bicuspid. This was non-probable, and the x-rays show no decay, but in the lower picture you can see that the decay was significant. So I think that there's a question there. Thank you.
All right, the other folks that signed up against fluoridation of our water, but unfortunately are not going to be able to speak due to time constraints: Clay Defoe, Scottish John Daisley, Babs Warren, Lee Fallred, I believe is what that says, Philip Green, Chris Bailey, Alan Johnson, Neil Carmen. And now we'll go to the folks who are in favor of fluoridation of our drinking water, and the 5 folks that have signed up, I'll call in the order of the list you turned in. First speaker is Rachel Oswalt. Welcome, Rachel. You'll have 3 minutes.
Good afternoon. My name is Rachel Oswalt, and I am a registered dental hygienist practicing here in the city of Austin. I am the second vice president of the Texas Dental Hygienists Association, and I'll be reading a statement prepared by our president, Olivia Schreiner. The Texas Dental Hygienists Association supports water fluoridation as a safe and effective method for reducing the incidence of dental caries. We concur with many other respected organizations that have already cited the history, safety, and cost-saving effectiveness of adjusting the levels of this naturally occurring element to optimal levels to benefit the oral health of citizens of all ages. The American Academy of Pediatrics, the American Dental Association, the American Dental Hygienists Association, the American Medical Association, and many other respected medical and health organizations recognize the health benefits of fluoridation. The U.S. Centers for Disease Control and Prevention call the water fluoridation one of 10 great public health achievements of the 20th century. Not only do studies show that fluoridation reduces tooth decay by 18 to 40%, but we also know that Texas saves $24 per child per year in Medicaid expenditures for children because of the cavities averted by drinking fluoridated water. U.S. court decisions have rejected the argument that fluoride is a medication that should not be allowed in water. The American Journal of Public Health summarized one of these rulings, noting that fluoride is not a medication, but rather a nutrient found naturally in some areas and deficient in others. We believe that those who prefer not to drink from a public water system can do so. Maintaining an optimal amount of fluoride in water is based on the principle that decisions about public health should be based on what is healthy for the entire community, not based on the fears of individuals who have extreme opinions about their drinking water. In my own clinical experience as a practicing registered dental hygienist, I see firsthand the destructive effects of dental disease on the dental consumer, especially children. Children should not be suffering a decline in academic achievement from missed days of school due to oral pain and disease. Children in the 21st century should not be suffering the pain of preventable dental disease. Thank you for the opportunity to speak on behalf of the Texas Dental Hygienists Association.
Thank you, Rachel. Folks, I'm not going to tolerate you guys outburst. Nobody said a word when the other 5 spoke. Just offer them the same respect. And if you can't control yourself, you can go watch it in the monitor on the monitors in the atrium. Whether you're for or against this, everybody gets their 3 minutes, and we can do it without outbursts. So I'd appreciate some self-control. The next speaker is Dr. Jeff Brunson. Welcome, Dr. Brunson.
Good afternoon. My name is Dr. Jeffrey Brunson. I'm the president of the Capital Area Dental Society, which is the local component of the Texas Dental Association and the American Dental Association. Thank you for the opportunity to testify on the important issue of community water fluoridation. I and several of my colleagues that practice and live here in Austin are here to express our support of community water fluoridation and speak against the proposal to add a warning about fluoridation to the Austin utility bill. I've been a citizen of Austin for more than 10 years. I've had the opportunity to be in both public health and private practice dentistry. This issue is very important to us as dentists because we care about the overall health of Austin. Austin is our home as well. I'm the father of 2 children. Certainly I care about the health of my children, but I'm just as concerned about the health of my patients, my friends, and the other citizens of Austin. When I was informed that fluoridation was being discussed locally, I did not rely on my previous knowledge. I chose to look further into available resources. My current opinion on water fluoridation was developed through thoroughly reviewing research articles. My reviews of these materials led me to believe that water fluoridation, as suggested by the Health and Human Services, continues to be a safe and effective way of reducing dental disease. In the discussion of fluoride, freedom of choice is often one of the strongest complaints. However, fluoride must not be considered alone. The American government supports the fortification and adjustment of food and drink products to support the health of Americans. Notable examples of this are iodine in salt, vitamin D in milk, iron in bread and breakfast cereals, and chlorine in water. Community water fluoridation adjusts the amount of fluoride in the drinking water to the recommended optimal therapeutic level to account for all of these possible ways that you might ingest it. Like many common substances essential to life, the good health and too much of a good thing can be dangerous. Certainly salt, iron, vitamin D, and even water can be dangerous if consumed in excessive quantities. Fluoride in low concentrations used in optimally fluoridated water is not harmful or toxic. The implication that fluorides in large doses and in trace amounts, such as that in community water fluoridation, have the same effect is unfounded. The previous past president of the American Dental Association has recently quoted as saying, "Dentistry has succeeded in preventing disease better than any other area of health care. Water fluoridation is one of the most potent weapons in disease prevention, and we want as many people as possible to have the benefits of this simple, safe, inexpensive, and proven health care measure." Many of the things that you talked about before we got to fluoride today were about protecting the citizens of Austin, and I would certainly hope that you would support us in this matter as well. Thank you.
Thank you, Dr. Brunson. The next speaker is Dr. David Slaughter. Welcome, Dr. Slaughter. You'll have 3 minutes.